My name is Rosemarie Rose. I'm an integrative family physician, and I work at Steinmetz Center for Integrative Medicine. So I actually see a lot of people who complain of fatigue. It's one of the most common conditions that people come in for because it's hard to address and it's multifactorial, and there's lots of reasons someone would be fatigued. And it is often accompanied by other symptoms. Often there are sleep problems that contribute to the fatigue. And a lot of people will complain of something we call brain fog, where they're just not thinking as clearly as they used to. So the integrative approach to treating fatigue is a lot broader in medical school. In medical school they'll say, oh, you know, check a blood count, be sure they're not anemic, and maybe check a thyroid panel, and if those are okay, then there's no reason for their fatigue. But then what? So the integrative medicine approach really answers that but then what question. So we will look at fundamental things like, are you sleeping? Are you eating well? Are you doing something to manage the stress in your life? What are the factors that are contributing to you being fatigued? Some of the other causes of fatigue that we find often have to do with either nutrition or some of the endocrine hormonal systems. In the nutrition realm, a lot of times we'll see people who simply don't have enough vitamin D, and we can supplement that and they'll feel better. A lot of times it's an iron deficiency, and there's a few other things that we'll check in a nutritional sense to see what might be contributing to their fatigue. With regard to hormones in the endocrine system, one of the big causes of fatigue that we see is adrenal fatigue. Our adrenals are little glands that basically are responsible for responding to stress. They tell our body what to do. And we live in an incredibly stressful civilization, so much so that we don't even realize it because this is just what we're used to. So one thing we end up doing in integrative medicine is recommending a whole lot of stuff. And sometimes it's frankly overwhelming for people who come to see me and they're going, you just told me 10 things to do. So we have to be real careful about understanding that this is a process. It's not going to happen overnight. And we can help you prioritize, figure out which things are going to be the most helpful to do first. There's something in integrative medicine we call the rule of tens. And that is, yeah, we might tell you to do some breathing exercises and change your diet and start exercising and take these supplements and this medication and eat these things. And we'll tell you 10 things to do. But if each one of those things makes a little 10% improvement and you do 10 different things, pretty soon you're at 100%. That's the heart of integrative medicine. We are giving your body what it needs to be its healthiest and to work its best.